We're going to go over a regular bridge and then a single leg bridge. I'm not going to go over this in too much detail. I think you guys kind of know how to do this. The two things I'll bring up are one, pelvic position. So a lot of people, when they bridge, they posteriorly tilt as they lift their butt off the ground. So the only thing I like to do is make sure I've got a little space here. Maybe I'll have the patient feel what neutral spine feels like. Maybe I've done some other exercises with them so that they can kind of figure that out. And I just let them know that they don't want to lift their tailbone up and go into a posterior tilt. They want to maintain neutral and then hinge the hip up. When we get into hip hinging in neuromuscular reeducation, we'll revisit this idea. But just to point it out, you don't want people overly posteriorly tilting during a bridge. The other thing I'll mention is a lot of times we discussed in class, people will kind of excessively use their hamstrings, and the way that you avoid that is making sure that the feet are not slid too far out. You want to have the feet a little bit closer to the body. Another thing is planting the weight through the heels. So you don't necessarily want to have the patient dorsiflex, but just kind of bear their weight through the heels. Same rules of a neutral spine. And then this position should allow the glutes to do a lot of the work. Same rules apply for the single leg bridge. Pelvic positioning is important in the sagittal plane, as we just discussed, but also now with one leg off the ground, I've got to make sure that the patient's not rocking side to side as they lift either. So as I come up here, I want my pelvis to remain parallel with the ground, no dipping in either direction. Sometimes I'll use a broomstick to give patients a visual guide. But those are the basic things about bridging to think about. The only other thing I'll add is I've got a dumbbell here. I do have patients load this exercise as a precursor to doing more advanced and functional hip hinging type exercises. So everything's the same. It's just that I have a weight that you want to make sure is comfortably resting on their pelvis. Everything else is the same. You know, if you have to use a pad or something to make it more comfortable, that's fine. But I want this bridge to look just like it did before. Now it's just a little bit loaded up so I can get a little more resistance to the movement.